welcome to Spilling the Milk, the podcast where we talk about the joys and the challenges of breastfeeding. We talk to different moms and different experts, and the goal is for every mom who is trying to make breastfeeding work for them feel like part of a community and not feel alone and not feel like they're the only one going through this. So thanks for joining. Today, I'm excited to welcome my guest, Dr. Zora. She has a chiropractic practice near me in southeastern Michigan. We actually met in person at a recent event for new parents called Babies and Bumps Detroit. And we had already been following each other on social media, and it just made sense to chat a bit in person and then bring her on the podcast. So I'm excited to dive in with her today about chiropractic care for newborns and moms. And she specializes in this area. And I have questions for her. I'm curious. Anything I can do to bring information to you about your options for supporting your health as the mom and your baby's health, that's what I'm here for. So let's talk to Dr. Zora.
So I am a chiropractor. I've been practicing for 13 plus years now. I got into chiropractic because I really love helping people. And definitely the natural holistic way too. I think there's like enough medications out there and invasive procedures that people are definitely looking more towards what's more natural. How can I be healthier without really band-aiding, I guess, different things. Yeah. So, and then the last few years, I have been more interested in mostly working with women and kids. And I've done my pediatric seminars that I've taken and Webster certified. It's a chiropractic technique geared towards balancing the pelvis in pregnancy, which I'll talk about some more later, I'm sure. But yeah, so I've always loved working with women and kids. But ever since I became a mom about 3 years, almost 4 years ago now, it's like me learning from my own experiences, both for me, myself, when I was pregnant, postpartum, and, babies and kids, that's really like my main focus. I just love helping moms and kids the natural way also. Excuse me. So yeah, that's been my focus. I was working in a group practice, and more recently I branched out on my own. It's something I've always wanted to do also. So it's been awesome. Actually, the last 3 months I've been on my own and just building my practice that way. And that's how kind of I met you because I was at a event and just trying to get the word out about chiropractic, especially in for women, pregnancy, postpartum, and babies and kids. So that's where I'm at right now. I love bringing awareness about chiropractic and for kids, especially. I think still a lot of people are like, why would a baby need to be adjusted? Like, why does a baby need to see a chiropractor? And there's many reasons, which again, I'm sure we will get into. But yeah, that's why I love what I do. It makes a big difference in people's lives.
Yeah, no, and I'm happy to have you in my referral network. So when I'm meeting with a mom in my support group or in my breastfeeding class, and it sounds like maybe they or the baby would benefit from chiropractor care, now I have a local resource to refer them to. So that's really lovely.
Yeah,
and actually, great. I think maybe dive right into the benefits of chiropractic care for babies and kids, because I think we can wrap our heads around an adult going to see a chiropractor, but maybe not a baby. So yeah, enlighten me.
Yes. So I'll tell you a lot of times why someone would bring in their baby is because latch issues. Like that is one of the number one things. They're having latch issues, and actually their lactation consultant would recommend chiropractic. So that's one of the reasons. And with the latch, we assess the jaw first, and the cranial bones, the neck, and then definitely look in the mouth for any ties. So this is my experience, but a lot of ties are actually missed by many professionals. So there are a couple of different tongue ties, and the well, I shouldn't say most common, but the most obvious one is an anterior tie. So everybody can kind of see that, anyone
Yes.
can look. But there's another one that also occurs, but it's a posterior tie, and almost everyone misses that one. So that's something I would love to educate even like lactation consultants, because they miss it as well. I mean, pediatricians miss it, lactation consultants, the moms miss it. So, and that is, it definitely affects the latch as well. It affects reflux, the feeding. So it's something I definitely look for.
Mm-hmm.
And then with the jaw, if there's any restrictions, I work on loosening that. Sometimes that alone definitely
Mm-hmm.
changes things.
Mm-hmm.
And we also assess if the baby needs a revision or not. Not all babies do, especially if they are, let's say they are latching, and I do find that there is, let's say, a posterior tie, but breastfeeding is comfortable and baby's doing well, we kind of leave it alone,
Yeah.
you
I actually
know?
had a mom like that who everything was going well. And she was like, I feel like the latch could be better, but I have no real issue. And I just reflected back to her, like, it sounds like you don't necessarily want to change anything. You are just recognizing that you feel this way. So I have seen that happen for sure.
Yes, yes. So that's with the latch. Another thing, actually, this one, it's more like sometimes parents come in for themselves to get adjusted, and their baby is, in the car seat, let's say, waiting. And I look, and the baby's head is like this, the whole time, or
Mm,
turned, to the side, either side.
yeah,
And it's just so obvious to me, right? Because I know what I'm looking for. But usually
right.
I'll ask the parent, I'm like, are they always like this? Do they kind of look like they're always preferring to be the one side, or their head is always in a tilt? They think
Mm,
about it and they're like, actually, yeah, I didn't think of it. So that's something you definitely want to address early on, because those are the restrictions in the neck. And
mm,
those restrictions, if not resolved, they, imagine if the baby's always turned to one side, they're always, when they sleep, they're turned this way.
mhm.
That part of their head is contacting the, heart surface, that's the bed. So then they develop that flat spot. And it's
Right,
so common nowadays. So it
right.
could be either side. And sometimes the flat spot is like right dead center.
Yep,
And that one I find a lot with the babies that sleep for a long time, which is, you think is a good thing,
right.
but they're always like, in some kind of container. It's either like the bed or, those like mama roos or whatever
Yep.
containers. Sometimes in a car seat for too long.
Mhm.
So you definitely want to do something about that. And another misconception is they'll just grow out of it. Like
Mhm.
some will just say, oh, it's okay, it'll grow out of it. That's not true. They don't. They
And does
just,
it
the body
start
adapts, but
okay,
not in the best way. And then you have
right.
other things going on later.
And does that start in utero? Is it affected by the way they were birthed, or is it start when they are constantly sleeping in one position? It just sort of like perpetuates.
That's a great question. And actually, they think it could be any of those things.
Okay.
So it could start from in utero, the way the baby was in there.
Mhm.
If they were like not able to move as much and get in the best position, if they were like a breech baby, transverse, all of those things can affect. And sometimes it's the actual birthing process where they stuck for a long time,
Yeah.
and sometimes actually even that quick birth is traumatic too. So birth in general can be pretty traumatic for the baby,
Yeah.
whether it was like a home birth, C-section, a long birth, using forceps or vacuums. All of these things can be traumatic.
Mhm.
So it could start there. It could start with the birth. And then it could just be the way they're held. Maybe you're always holding your baby on that one
Yep.
side,
Yep.
and then they turn their head and look out,
Yep.
because they want to see the world. That
Mhm.
could be another reason, or the way, yeah, they're sleeping.
Okay.
But usually, I feel like the sleeping, um, if they are preferring one side, is because they just can't turn the other way.
Right.
It hurts. It doesn't
Yeah.
feel good. So then they're always just to the one side. And that's where I come in to assess, well, where is it that it's restricted? Just like in an adult, but the adjustment for the baby is completely different than an adult. So if
That was
you've been
my next
adjusted,
question.
yeah. So we're not like twisting, there's no
Right.
cracking. You're never ever supposed to hear a crack,
Okay.
actually.
Okay.
Yeah. It's very light pressure, specifically to the joint that needs it. Never twisting, never popping. It's just a completely different way of adjusting. And that's why it's a really good idea if you do decide to take your baby or a small child to a chiropractor, make sure that they have that pediatric background.
That makes sense. I think I have heard that you can even have the chiropractor come to the hospital, like very soon after birth. Is that useful?
So the hospital thing is, I believe, is dependent on the state.
Mm,
So in some states, chiropractors do have the privilege to go to the hospital. You need the hospital privileges.
okay.
I don't think in Michigan we do
Okay.
technically. Yep. But what I recommend to, my pregnant mamas that I see, I always emphasize how important it is to bring the baby in like a week, that first week of life. The first week of
Mhm.
life is really important. Because imagine if something was going on from in utero or the birthing process, and then the baby's like, adapting to that rapidly soon after birth. Um, Other things can start happening, like the latch issues, like the flat
Right.
head, colic, reflux, all those things are affected.
Mhm.
But yeah, so for me personally, what I would love to do, and it's something I've actually thought of for years now,
Mhm.
is to um, give the mom an option to have me go over there that first few days, first
Yeah.
week, even first couple of weeks, if they don't want to leave their home.
Yes.
I totally understand. I've been there,
Mhm.
go there and check the baby.
Yeah, I think that'd be a really useful service. And
Yeah.
one of the benefits, like putting myself in the place of the new mom, is just having someone with so much experience seeing babies and assessing their health and just being able to say, like, everything looks good. Or, yes, we did this adjustment and now at least you've taken care of like one variable, in terms of breastfeeding success. Like, well, I can tell you their alignment is fine. I've checked their jaw, I've checked for ties. So if there's still a different issue, now here's what you could look into. But you're at least like giving them reassurance, like an expert opinion. Because when it's your first baby, like you have nothing to compare it to. Is this
Nothing.
normal? Is this the rarest condition that could possibly happen? Is it somewhere in between?
Yeah, no, exactly. That's exactly it. And that's why I really do emphasize that, like, even like the first couple of days, if everything went okay, the baby doesn't need to be in the NICU or anything, definitely the first couple of days, if not that first week. It's so important. And just like you said, it totally makes sense. So let's rule out, those like biomechanical things that could be happening. And then figure out, well, is it like the positioning, when you're breastfeeding is a
Right.
problem? What other things can we do? For that. But yeah, you want to like rule out as many with babies, is what I've learned personally, is you're always like trying to rule out things
Yeah.
because they're a brand new person too. They've never been here before. So everything is new. And I'm sure you know this, but they talk about how natural it is to breastfeed.
Mhm.
I don't know about that. It truly, like, I think, yes, we obviously need it, but natural in the way that it doesn't come naturally to everyone, and even
For
the
sure.
baby,
For sure.
right?
Well, in most of history, you would have seen your aunt nursing, your cousin nursing, your best friend nursing. It would have been very normalized. You would have been like immersed in that culture. You would have had your mom, your aunt, your cousin, your sister sort of like helping you, also taking care of you. So in the best circumstances where it's like part of the culture and you have all this support, yeah, it should feel somewhat like a natural thing you do after you give birth. But in our society, it does not get treated that way. And so there definitely is a learning curve for mom and baby. I would say more so maybe than in some other cultures.
Yes, yeah. Yeah, that totally makes sense.
But
Yeah.
I love the idea of you working hand in hand with a lactation consultant.
Oh
You
yeah.
you have the same goals as the welfare
Yes.
of the mom and the baby. I do want to switch from baby to mom because I think a misconception I see is that like you have no control over the way your birth is going to go, that it's just sort of like a crapshoot. And I think it is empowering for women to know that you can be doing things during pregnancy, like prenatal yoga, like seeing a chiropractor, like getting prenatal massage, that can set your pelvis up for success during labor and delivery. So, could you speak a little bit about the benefits of seeing a mom when she's pregnant?
Yes, definitely. I'm glad you brought that up. It's, again, I can tell you from experience, if you were to interview every mom I've ever, treated while pregnant, and this is just the ones I've seen, not, I'm sure if you interview other chiropractors who also see pregnant women, they will report that their labor, their delivery, and even their postpartum is like so much smoother. And I'm telling you, these are some of the moms also that this was their second or third kid too. So they're comparing, right, to their other birth, and they're like, I wish I would have done chiropractic care while I was pregnant with my other pregnancies, because it makes a huge difference. And sometimes I get the question, when should a pregnant patient see a chiropractor? And it's like, at any point really, but definitely as soon as you find out you're pregnant, if you were not already under chiropractic care. Because if we start from the very beginning, before things start to expand and ligaments start to tighten and muscles, right? If we can start from the beginning, balancing your pelvis, then as you grow, you will grow more balanced, right? You're not, so structurally, we can definitely work on things early on. But I've definitely also had moms that come in like close to their third trimester. And it's because that's when they heard about chiropractic, So it's like, of course I'll see you. Of course I'd love to help more. But yeah, it does make a big difference. And I think that also, not only is it helpful for the mom because then you feel great, right? During pregnancy. Like another thing that sometimes I get when I get a new pregnant patient, they're like, oh, well, I have this pain. Well, it's normal, right? I'm like, well, not really. It's common. It's very common, but it's not normal. You shouldn't be in pain. I personally, and I do talk about this, I was not in pain during pregnancy. I actually had a very easy pregnancy, and I've only been pregnant once, and I only have one child, right? And I never ever thought that, because I was surrounded by whoever would get pregnant around me. Usually they would have back pain at least, right?
For sure.
Or have a hard time walking or moving around. I worked until the very last day. I worked a Thursday and I had my son on a Tuesday.
Yeah.
And my job is physical.
Right. True.
So it definitely is possible. I definitely credit chiropractic care for myself and yoga. I did a lot of yoga. I did yoga for years before that. And during pregnancy, and I was pregnant while it was COVID also, so you couldn't really go to the gym or anything. So I just did it at home. So even now, when I advise my patients, I always give them stretches and exercises as well. And a lot of them are very, very like yoga stretches, right? Yoga exercises. And I'm like, you don't have to go to the gym. You can do them from home. It really helps to prepare the body, and it works hand in hand with what I'm doing, because I will adjust and balance the pelvis and give them these stretches and exercises to keep it that way, right? To maintain, so they're not so dependent on me, right? Like I want to give them control over their bodies as well.
Well, and I think, so for me, some of the benefits of prenatal yoga is that you are tuning into your changing body. So you're doing the same pose that you did last week, last month, and you're like, oh, when I do it now, it feels this way. Something surprising is that you actually can become more flexible, because the changes going on in your body are opening up your joints and making you more flexible. So you do have to be careful, but like, oh, this is interesting. So I love how you said that, because you're not going to be with them 24/7. You're going to adjust them, keep them maintained, but they are with themselves 24/7. And so they need to be able to tune into their own changing body, what feels good, what doesn't. And then I love prenatal yoga for learning to stay in discomfort without freaking out, because
Mhm.
that's the success. If you're going to go through labor, can you sort of lean into, calm into a sensation, and you can practice that when you're doing prenatal yoga in like a low stakes way. So it sounds really complimentary that the chiropractic care with you then recommending that they do stretches and yoga on their own.
Oh yeah, definitely. I've never not recommended or given yoga to a patient. Yeah, for
Awesome.
sure. And another thing that really helps is with yoga, you do, just like you said, it's, you stay in those positions that are kind of uncomfortable, and it really
Mhm.
helps. And while you do that, you are doing that deep breathing. So
Yep.
another thing that's preparing you, right,
Yep.
for labor, because to get through it, you do need to breathe and
Mhm.
the right way.
Yeah,
So
and to
yeah.
make that automatic. So to make your automatic response to discomfort to deepen your breath, to stay in it, to tell yourself you're going to be okay, you're going to get through this.
Yes.
Yeah, that's invaluable for labor
Yeah.
and
And
breastfeeding and being a parent.
oh yeah, all of it, right? All of it. And
Yeah.
another thing that is very similar and complementary in both chiropractic, treatments, care, and yoga is that because you're kind of slowing down, and it's more of like a stretch and a breathing. Um, they both access that parasympathetic nervous system, right? Which
Mhm.
helps you relax. And if you do it enough, it does kind of become more like automatic, like you
Yeah.
said, like natural. And when you are in labor, actually, if you do slow down and allow your body to relax, that's when it will go smoother rather
Yeah.
than being in that sympathetic state.
Yep. I'm actually
So,
writing a book about that right now.
wow.
That's the whole thesis, yes.
Yes. Oh, there you go. Yeah.
Mhm.
So there's a lot there. And so I can just give you an example of how chiropractic care, especially during pregnancy, accesses the parasympathetic system.
Yeah.
Is part of the parasympathetic system is in the pelvis. It's in your
Mm.
sacrum and
Mm.
lumbar spine. And when I work with pregnant mamas, that's mainly where I go to adjust and work.
Yeah. And then in labor, because I know, like, I've had a doula who did a hip squeeze or did,
Hmm.
like, a heating pad with a tennis ball going probably on my sacrum,
Yeah.
basically.
Yeah.
So, yeah, that's, like, clicking
Yeah.
for me now that that's where she was focusing her
Yeah,
energy and
yeah, and
heart.
that's where it accesses the parasympathetic system, the system
Mhm.
of like, okay, relax, and then things can happen.
Yes.
Not being in that fight or flight.
Which is tough because we like to control. We like to have a plan,
Mhm.
and we like to control the outcome
Oh
if we
yeah,
can, and in labor, that is not what you need to do.
nope.
Yep.
Yeah,
So, as soon as you said you became a mom 3 or 4 years ago, I knew you had a COVID baby. So, you
yeah.
went through the very unique situation of being so isolated. I just talked to a mom yesterday, and she said all of her prenatal visits were over Zoom. She was taking her own blood pressure, and she bought her own Doppler and had to learn how to
Oh.
find her baby's heartbeat on her own and then
Ooh,
report it over Zoom to her doctor. I was like, "That really happened?"
wow. Okay,
So I'm
well,
curious
that was
about
not.
your. Okay.
Yeah, no, that's really extreme. Maybe it. I'm not sure. Maybe that happened like March or
Right. I
April
think
or
so.
something,
Yeah.
2020. Yeah, I had my son in July 2020. So yeah, what happened was, oh, I do remember my 20-week ultrasound, which is the anatomy scan.
Yep.
My husband couldn't go with me. It was
Oh my
just
gosh,
me.
that's the
Yeah,
best part.
I
Oh.
know. And it's like our first baby, right? Our only
Yeah,
baby.
that's
And I
really
was by
tough.
myself in there. That was kind of sad.
Yeah.
Yeah, yeah. And then all the other appointments, I want to say I was by myself. Yeah. Yeah, I was by myself. And
Mhm.
then having him in the hospital, it was only me and my husband, like no visitors, which in a way that was kind of nice.
Yeah, honestly, I know
Yeah.
you didn't even have to tell anybody no. You were just like,
Yeah.
"Oh, this is the hospital policy."
So it was nice. It was intimate. Our son was with us the whole time. So yeah,
Yeah.
yeah.
And then
But
can
yeah.
you speak to your own experience with breastfeeding? How did your
Mhm.
start go, and how was your journey?
Yeah. And this is where I learned a lot. And this is actually one of the reasons why I delved more into the ties, because prior to that, I really didn't deal with a lot of ties. And to be honest, I was also someone who would have missed the posterior tie, and I did. So what happened with my own experience is I didn't have the best experience. And in the hospital, I definitely wanted to breastfeed. I mean, my vision of breastfeeding was because I had such a good pregnancy, right? Everything is going well. And with all my knowledge and everything, I'm like, I definitely want to breastfeed for a good year, right? In the first 12 months. Well, right in the hospital. So I think what kind of, triggered everything was I ended up with a C-section. So they say, so that was a little bit of a traumatic thing for me because I always wanted, all natural, that's what was in my mind. Again, this is something when I do have patients now, I try to tell them, like, sometimes you do, you have expectations, but always just be open to other things, right? So anyway, I'm not going to go too much into that, but I think that was something because it wasn't expected and it happened. It just kind of derailed my mind, kind of thing. Yep. So initially in the hospital, he latched, and everyone I had 2 different lactation consultants that came in, and they're both like, they looked at his latch and they're like, oh, he's great. He doesn't have any ties and you're doing so great. So I think that first day, I was breastfeeding him, and it was probably colostrum, right? So it wasn't much, but he was happy. I mean, he'd latch on and then go to sleep, as babies do the first couple of days. Yeah. So that first day was fine, but then the second day, it was like super painful to the point where like I started crying from the pain. And I'm like, what's going on? And I asked them, and I think that's when the second lactation consultant came in. And again, she checked him and she's like, yeah, he has no ties. She's like, I think you just need to get used to it. But at this point, because he was latching on so often that, and not to be, too much TMI, but they're bleeding at this point. Yep. And this is only day 2. Yep. We tried I don't even remember what they were now, but some kind of gel like pads and whatnot that
to soothe. Yeah.
Yeah, to soothe, but nothing was working. It was super painful. I tried to pump. So now, I think the third day we go home and I'm trying, and it's like it was one of the most painful things I ever had to endure. Yeah. And it was so sad because I really wanted it. So I'm trying so hard, but at the same time, it's like, he's now hungry and gets fussy because he's not able to, get the milk. And from what I remember is he would latch on, but then it was painful because he would kind of come off, and so that's why I'm like, everyone's telling me he's fine, his latch is good, but why is this happening? And I tried all these different positions. I think like a week or so later, I think it was a week after, he was a week old, I had another lactation consultant come to my house. Yeah. And again, she checked and she said, these has no ties. So long story short, everybody's telling me no ties. Pediatricians told me no ties. At the point I didn't know, and I'm a new mom. I just had surgery, it's like so many things happening. And come to find out, he had a posterior tie the whole time. And that's why, he was coming off. He wasn't able to just stay latched on. And I tried all these different positions, and it just, wasn't happening. And unfortunately, I even tried, it was like up to 10 weeks. 10 weeks I went back to work. Yeah. Even then I contacted a different lactation consultant, but at that point I had lost all my supply. Yeah. And she said, it's really hard to regain it after 10 weeks. Right. I tried the pumping for a few days and it just didn't happen. So, and I had to give up. Unfortunately, I really didn't want to. So that really taught me a lot. And that's when I'm like, and actually what happened was how I found out he has a tie is I brought him to my colleague who was seeing a lot of babies with ties, right? She knew what to
Yeah.
look for.
Yes.
And I'm like, can you just take a look? And he was 6 months at this point, so definitely too late to try to,
Right. Right.
reestablish anything. As soon as she looks, she's like, yeah, he's got that posterior tie. And she's like, and he has a lip tie. I'm like, okay. Yeah.
Oh my. Yeah. So
Yeah.
this is personal for you because if you can
Yeah.
catch this for other families, like you are impacting their lives.
Exactly. Yes, so
Yeah.
much. And it's not just for the baby because breast milk is amazing, right?
Right.
But it's also for the mom,
Yeah.
right? Like I wanted to do that so bad
Yeah.
and I just wasn't able to because everyone basically was kind of like, baby's fine, it's probably you.
Right.
That's kind of what I got from it. And I'm
Right.
like, well, that's my body, I don't know, like what do you do at that point? So I
Mhm.
I do wish I knew more like what to look for at that time,
Right.
then I would have, done something about it. But that's okay. That's my experience, but that's why I
Mhm.
want to change that for other moms,
Yeah.
you
So
know.
posterior tie means like the back of the tongue is
Yeah. So it's, when the baby,
yeah.
when you can get them to lift their mouth. A lot of times when they're crying, you can really see it. Like you don't even have to go in
Um,
there. A lot of
okay.
times I just see it when they're crying. The anterior tie or the one that's really obvious, I mean, you
Yeah.
can see that line, right?
Right.
The posterior, it's really tiny in the back, but one telling sign is the tongue. It like when they're crying, it's not just straight. There's a little like it's like a curve.
Okay.
It's like a C. That's what
Yeah.
the tongue looks like because there is a little bit of a tug from the
Uh-huh.
bottom that gives it that shape. So when they're crying, the tongue is not just like flat. It has
Hmm.
like a little curve. I don't know if that makes sense.
It does. Well, I mean, I think like I would have to see multiple examples of like this is not and this is, which is
Yes.
what you've done. You have the experience, you can visually just diagnose it like that.
Yeah.
But I'm just guessing that that impacts the ability to form like a vacuum seal, like because the tongue is very instrumental in forming like a vacuum seal for then the milk to like flow into the baby's mouth. So I'm
Yes.
guessing that the tongue just can't make the right shape to form that vacuum seal.
Yeah. And actually, another thing is like now that he's older, he can not stick out his tongue all the way.
Oh, so now I mean, obviously, like after the fact, be like, yep,
Yep. Oh
that's
yeah. Yeah. Like I'm always, watching him obviously. And
yeah.
yeah, I noticed that he does not, I mean, I look at other kids and they're like almost, like their chin or what their nose and his is just not, doesn't go very far. So that was another thing. It's like, do I clip it or like laser it? Do I
Yeah.
leave it alone? I decided to just leave it alone because when he was eating solids, there was no
No
choking
issue.
or
Mhm.
nothing like that. No real issues. He can lateralize and chew and do all those things. But I know adults that have gotten their tongue tie released as adults.
Oh,
So
okay.
yep, yep, and it can definitely still help with certain things. So
Hmm.
it's always in the back of my mind, and if I feel like he gets to a point where it does affect something,
Yeah.
then I would do that.
Do you
But right
have
now,
a local professional that you refer to have the lasering done?
so there are a few that but I actually haven't, met with them yet, and I would really
Mhm.
love to do
Yes.
that. But there are a few that are very well known,
Okay.
that are really good with these things. But for me to recommend, I do love to like meet people like one
For
on
sure.
one. To get to know them. But yeah, there are some very highly recommended too.
Mhm.
Yeah.
So, I mean, for anyone listening, it's sort of like definitely meet with a lactation consultant to make sure the latch is good. And if they or you just have a feeling that something else is going on, chiropractor. Chiropractor can tell you if it's biomechanical, if it's something we can fix with an adjustment. Or chiropractor can say, I trust this. I mean, is it a pediatric dentist that would do the laser for the
Not necessarily. Not necessarily. You can do pediatric dentist, sometimes just a general dentist
okay.
who they've done that. Sometimes ENTs as well do it.
Okay.
Yep.
Good to know. So
Yeah.
that's sort of the progression of professionals, and so that's why it's so important to me to build this network. Um, I just know so many people, and it does seem like you have to extra advocate for yourself. Like you have to say multiple times, something's still not right. Can you check for a tie?
Yeah.
And they say everything's fine. And then you go to the next professional and you say, can you check for a tie? But it really feels like an uphill battle. I've talked to so many
Yeah.
moms about this issue, and
Mhm.
or when they're in the hospital, the professionals there are basically instructed to just not ever say the word tie. I don't know what the policy is, but it's like it's so hard to get someone to admit that maybe this is an issue. Um, so yeah, I just want people to be aware that this could be something that comes up, and there are professionals that can help you.
Yeah. Wow. I didn't know that about the hospital and not wanting to talk about ties.
This is anecdotal, but that
Mm,
I've just heard it so many times that
okay.
no one's willing to say it. So
Man.
you
Yeah.
kind
I
of have
mean,
to
that's
advocate
not
for
very
yourself.
helpful.
It's not helpful. And I mean, when you're the mom, like this is affecting you daily, hourly. This is your life. You are
Yeah.
just trying to get milk from you into this baby's mouth. And when it hurts and when it feels like it's never going to get any better, it is the most defeating feeling.
It really is. It really, really is. Yeah. Yeah. Just for me personally, it was the hardest thing I've ever had to do.
Yeah.
And and I'm the kind of person who I do work hard at things, right, that I
Me
really
too.
want, and usually I accomplish. But this one I worked so hard and I couldn't accomplish. So it was
Right.
defeating. Yeah.
Because there was only so much you yourself could do. There were other
Yeah.
variables at play that you could not control for.
Yeah. And when you've just had a baby, I mean, you're so vulnerable and and then you do want to trust other professionals, right? And
Yeah.
when everyone is telling you, "Oh, everything is good," but you're like, "But something isn't right."
Yeah.
And then you just sometimes don't trust yourself, right? And I think you can't blame yourself either for that because you're like, oh, well, you're the professional. You've seen this. Like for me,
Right.
I've never had a baby. I never had to breastfeed before. This is all brand new to me.
Yep.
This is all you do, right? Or, you work with. So I trusted them.
Yep.
But that's why I really think like one of the reasons why every baby should be checked by
Mhm.
a pediatric chiropractor
Right.
early on is really prevention to prevent these things and
Yeah.
to have the best possible outcomes when it comes to breastfeeding to when it comes to development, even reaching
Mhm.
milestones,
Right.
for the moms to have a better postpartum
Mhm.
also, physically and emotionally, mentally.
Yep.
So
And then, so adjusting, like in the situation where the baby's head is always tilted to one side when they're sitting in the car seat, when you do take care of that early on, is that something that prevents them having to wear a helmet later on? Is that related to
yes,
that? Okay.
yes, yes, exactly. Yeah. And I'm sure you've seen helmets are all like they're just so common now.
Yeah. Right.
You
I
know,
definitely saw a change. Like my oldest is 12, and even from when he was a baby until now, it's just seems like it's become more prevalent.
yeah, yeah, because those things are going unnoticed.
Mm,
And once they are noticed, it's too late, you
okay.
know? Or again, parents don't know that there's other options besides the helmet.
Hmm.
They think, oh, well, now he or she will need a helmet. But it's like, well, have you checked with a chiropractor who deals with these things?
Hmm.
Usually it's a no, because they didn't even know, like how,
Right.
how would that? So that's what I just really want to bring awareness to. And
Yeah.
it's so gentle. It works amazing. I have personally had a patient who I've known for years, and she got pregnant. She brought her baby um, because she brought her in because I'll never forget her. She comes in, the baby's in the car seat like this, like
It was
completely.
severe. So for people just listening, you turned your face like 90 degrees to the
Like
side.
90 degrees,
Yeah.
like completely.
Doesn't
Yes,
look
sorry, I
comfortable.
forgot this is also audio.
Yeah.
Completely like 90 degrees to looking to one side, and that's the baby's normal every
Right.
day.
Right.
And I don't remember, I think she might have been 4 weeks old at that time. And, so the first thing I did was release her neck so that she can turn both ways. It took a few visits. She hated it in the beginning because it hurt.
Mhm.
That's why she couldn't turn the other way.
Mm.
Yep, it was so stuck. So imagine, this is very common, and that's why I'm going to talk about it. But as adults, sometimes you're like, sleep and you wake up and you're like, I don't know what happened,
Yeah.
but I just woke up and now my neck, I can't move it to the other
Yep.
side.
That's right.
Like literally, that's what they feel. It hurts
Mhm.
and they're stuck that
Mhm.
way. So first thing I do is release it. But what I noticed with her is that she had already developed that spot, 4 weeks
Yeah.
old,
4
already
weeks.
had a
Yeah.
flat spot, and actually flat spot in that side of the head. Let's say, I think it was the right side. And what that does, because their cranial bones are still very soft and like
Mhm.
molding, because
Mhm.
they need to be in order to come out of the birth canal, right?
Yeah.
What happened is the same side, but in the front, like forehead, was a bulge. So it was
Mm.
almost like someone had pushed from
Yep.
the back and there
Yep.
was a bulge now in the front. So her
Yep.
head was all really, really, deformed basically.
Yeah. Well, that's
Um,
interesting because we all know babies' heads are so precious. You don't want to because they're still molding, they're still fit. Yeah. So the idea of developing the flat spot there sort of affects the rest of it. That makes sense if we think about it.
exactly. Yeah, because they're all connected. So I worked with her. I did a lot of cranial work. And she, every time she would go to or she would have an appointment with a pediatrician, the pediatrician was talking about a helmet.
Mm.
So I'm like, you know what? Let's do this. Come regularly. I'm going to see her. And my objective is to like not have her wear a helmet. So we're
Mhm.
going to do this. And so I did, treated that, corrected as much as I can. And every day I would also give them things to do at home also.
Yeah.
So again, you don't just, want to um, depend completely on the chiropractor or whatever provider. You need to
Mhm.
do things on your own because I can't see her every single day.
Right.
If this was my kid, I would do these things every single day.
That's
But
true.
I think I saw her twice a week. And so I gave them exercises to do with her and put her on her tummy. So putting on the
Mhm.
tummy that's why it's so important, because then their head has a chance to reshape too.
Mm.
But that's where, you can't just not do anything about it and hope for the head to reshape in tummy time. Like this is
Right.
me doing the work and
Oh,
then
right.
they put her on her
Complementary.
tummy as
Yeah.
much as possible when she's awake.
Okay.
So with this specific case, she ended up not needing a helmet, and she was 4 months old. So it took about 2 to 3 months of working on her regularly,
Mhm.
and them doing all the things that I had them do.
Yeah.
Um, Everything was like, I mean, it was amazing. I just remember she came in one day and it was just kind of like night and day. And I'm like, I don't know if I just wasn't paying attention as much, or it
Yeah.
just felt like, it just, everything was more symmetrical. It was kind of
Mhm.
amazing. And I told her I don't think she needs a helmet anymore. But when she went to the pediatrician for that evaluation, they said, yeah, she doesn't need it. So
That's
yeah,
really validating. Yeah.
it was amazing.
Oh, that's
It was
great. That's a
amazing.
really helpful case study. I think people can wrap their head around, if the pediatrician says, when you have this tiny baby, I think they're going to need a helmet eventually. Okay, we take in this information and there could be another option, and that's where you would come in.
Exactly. Exactly. Yeah. Yeah. Like just a lot. I feel like in the medical field, there's a lot of let's wait and see, right?
Mhm.
But I I don't agree with that. I think if you hear that, do some research. What else can be done instead of just
Yeah.
waiting and seeing?
Ooh, I
Because
am
if that
curious.
family had waited, she would have
Mhm.
needed the helmet 100%.
Right.
You
It's
know?
almost like self-fulfilling. Yeah.
Yeah.
This just occurred to me. I'm curious if you have any experience with an umbilical hernia in a baby. Is there anything chiropractic care could do for that? So I had that with two kids. The one resolved on its own within a year, and the other one did have to have surgery when he was like 4 because the wait and see, nothing changed. So they had to do surgery.
Yeah. I don't have like experience with that.
Hmm.
I've heard the same thing. Usually, you kind of wait and see, but now I'm just thinking about it, and I feel like with any like the hernias, if you can develop the core muscles,
Hmm.
that can help to close
Right.
it. That's what I'm just thinking now. So, how old was your first who it did resolve? Do you
I
remember?
want to say within his first year,
Within
it
the
did.
first year?
Yeah. So
Okay.
then when the second one had the same thing, I thought, oh, it'll resolve in the first year too. And
Yeah.
then before he started preschool or kindergarten, they were like, we should just take care of it now.
Okay.
But
Yeah, that's interesting. I'm gonna have to look into that.
yeah, yeah, look into
Yeah.
that one. I mean, I think it
Yeah.
probably couldn't have hurt to consult a chiropractor if there was, recommendations.
Yeah.
But that when you said wait and see, I was like, oh, I remember waiting and seeing, and nothing changed.
Yeah. Yeah, I will look into that. I definitely will. Because
Mhm.
it's probably going to be one of those things, once you like, if something comes up and you talk about it, I'll probably end up seeing, I'll probably have a
You are.
baby that will
Next
come in.
Tuesday, yeah, next Tuesday, your client is going to have this issue, and now you did the research and you're ready to go.
Yes.
That is fantastic. Well, is there anything we didn't touch on yet that you were hoping to share in today's episode?
Um, I think we covered a lot. I think
Mhm.
we covered a lot. I just hope that it was informative for any, parents, even other providers that are not
Mhm.
sure about what pediatric chiropractic is, or even
Yep.
prenatal, perinatal chiropractic is. It's all super gentle. There's nothing to be afraid of. I think
Mhm.
sometimes, if you watch one of those TikTok videos of like the loud pops and,
Yeah.
you know, people slamming on you, and it doesn't have to be like that.
Yeah.
For me personally, I've always been a gentle adjuster. I've
Mhm.
always been known that way, and I think that's why it really worked well for me to work with pregnant women and babies and kids, because
Yeah.
I do have a more gentle touch. So it doesn't have to be scary. There are so many different techniques. If someone, even an adult, if they don't like, the neck adjustments that have the popping sound, there's other things that can be done. I
Mhm.
also do a lot of muscle work. I integrate a lot of muscle work actually, because I believe it's not just a joint that needs work. A lot of times it's muscles as well.
Mhm. Okay.
And that's a lot of it with babies. It's a lot of it is muscles, some ligaments, cranial bones. So yeah, I just want to get across that, working on babies, working on kids and adults, it's all different.
Mhm.
And that's why you need someone who has experience in all of those populations, you know, um, to be more at ease with the work that we do.
Yeah. And right, you can only speak to how you practice and your experience. And so if someone meets with you, you might be a great fit for them. But I think we can give people permission to try a different chiropractor if you weren't happy with your experience. A
Mhm.
different person may have a different approach, something more gentle, a different type of training, like you have the Webster technique training that someone else might not have. So yeah, you just because I think it's possible that someone has had a bad experience or they heard someone had a bad experience and it turns them off from the entire profession.
Mhm.
So in today's episode, we got to know you. Clearly, you are compassionate and passionate, and like you take great care of the moms and the babies. So I am happy to refer people to you. If someone wants to learn more about you, what is a good way to connect with you, like your website, your Instagram handle?
Yeah. So right now I'm mostly on Instagram.
Mhm.
I love making videos. A lot of them are videos of like tips and tricks, especially for mamas. I'll be making some for babies as well, like the
Mhm.
things we talked about, like what to look for. Is your baby always,
Yeah,
turning their head to one
yeah.
side when they're in a car seat, for example? So that's a great way for them to also get to know me on there, see some of the work that I do, and also, if they'd like, I do offer complimentary consultations.
Mhm.
And if they want to go ahead and book the appointment, they can just do it through my link in there.
That's great. So we'll include
Yeah.
all the links in the show notes so people can directly click to your website to book with you. We should say you are in Southeast Michigan. Your
Yes.
office is in Birmingham.
Yes, I'm in Birmingham right
Yep.
now.
But you're
Yes.
also thinking about doing in-home visits. That's a goal of yours. So
Yes, actually, I am. I already started offering it to my existing prenatal patients.
Okay.
Yeah, and they're all very happy about that.
Yeah. You mean I don't have to leave the house with my newborn? I don't have to like get dressed? That would
Yes.
be great.
Yes. And especially if they have other kids, you don't have to find a babysitter,
Yeah.
or get all the kids ready and bring them. I mean, if they do want to, I'm, more than happy to have them come over, of course,
Yeah.
to the office. But yeah, it's something I've always wanted to do ever since I went through it myself. I know I didn't want to get out of the house at all. So yeah.
That's great. Well,
Yeah.
thank you so much for coming on Spilling the Milk. And it's been lovely to get to know you. And I can't wait to refer moms to you.
Thank you so much. And same here.
Thanks.
Take care.
Here are some of my takeaways from our conversation with Dr. Zora today. I heard that chiropractic care for moms who are pregnant can be really beneficial to relieve common aches and pains, or we consider them common, we consider them a normal part of pregnancy, but maybe they don't have to be. And not only that, but you are preparing the pelvis and the body for a smoother labor and delivery, potentially. She mentioned she also sort of assigns prenatal yoga in conjunction with the chiropractic care. So, further supporting the idea that prenatal yoga is really helpful for preparing the body and the mind for labor and delivery. We heard that having your newborn checked for their alignment, for their jaw, for possible ties by a pediatric chiropractor like Dr. Zora is can be really beneficial in just ruling out variables if you are having trouble with latching, or if you notice baby is favoring only looking to one side, or their head is most often in just the same position. That was really interesting, and it makes me think that it might be nice while you're pregnant just to become familiar with who in your area can provide that type of evaluation. I really enjoyed the conversation. I will link her information in our show notes. And if you have questions for her, you can reach out directly. I'd also love to hear from you. If you are interested in being a guest on Spilling the Milk, please reach out, Emily at empoweredbumpsandboobs.com, and we will get you scheduled. I also want to make sure you know that we have our Breastfeeding Bootcamp membership live. It's $29 a month. Your first 7 days are a free trial to check it out, but I'm in love with it. Obviously, I created it. I have over 100 on-demand lessons that teach you everything you need to know about latching, about milk supply, about pumping, about nutrition when you're the nursing mom, about how your partner can support you, about your posture, about your mental health while you're breastfeeding. So really a holistic look at how to be successful as a breastfeeding mom. We have our online community where you can ask questions and get answers from me, as well as connect with other moms who are going through breastfeeding, have been through breastfeeding. And we hold weekly live calls, so you can ask me face-to-face through the computer any questions you have, or if you want to talk to the other moms that are on the call. We have everything you need to feel supported without really having to leave home if you don't want to or just can't right now. This is all accessible from your phone, and I'd love to have you join us. Again, head to www.empoweredbumpsandboobs.com and check out the Breastfeeding Bootcamp membership. It also makes a fantastic baby shower gift. I can print you up a gift certificate, and you can be the star of the baby shower as you present a gift that people didn't even know was an option, this online on-demand course and community to prepare the new mom for her breastfeeding journey. What a lovely gift. Thank you for listening, and take care.